Hello all, and thank you for joining us today for the July 2020 Let's Talk on Sexual Healthcare and Reproductive Rights. My name is George Ferrari. I serve as CEO of Your Community Foundation. We're very excited to have a co-host for today's gathering, and that's Susie Brocky from our Women's Fund. So I'll turn it over to Susie to have her do a quick introduction.
Thank you, George. Thank you all for being here. We're very excited and proud to have Caroline and Dawn here as well. The Women's Fund respects all of the great work that Planned Parenthood does in the community. And one of the main objectives of the Women's Fund is to ensure that women have the necessary resources for healthcare, among many of our objectives. So we are very excited to help co-host this presentation today. If you'd like to learn more about Women's Fund, please go to the website or reach out. Thank you.
And the Women's Fund, to plan ahead a little bit here, is having a bit of an event. We're returning to our large in-person Women's Fund events, Susie, in October at Emerson Suites. And we're very excited to be able to reconnect and regather folks for what people really enjoy as a big event for the Women's Fund. There's always things going on here at Community Foundation. Let's Talks happen monthly. Our next Let's Talk will be August 9th. Jordan Clemens from Unbroken Promise Initiative will be talking to us about community organizing, community action. Very excited about this. These gatherings are intended for us to share some information. We're not going to cover every possible topic here, but information that are helpful to you as workers and actors and community members of our beloved community to improve what's going on by way of philanthropy, and also donors to plan your charitable giving ideas. So for today, I'm going to now introduce two folks from Planned Parenthood of Greater New York. They'll have a presentation for you. This presentation recording and PowerPoint will be on our website later. As you have questions, you can put those in the chat, and we'll have some time toward the end to have those responded to. We have Dawn Cornell and Caroline Praderio from Planned Parenthood of Greater New York. And I'll turn that over now to Caroline and Dawn. Thank you for being with us.
Thank you so much, George. Caroline and I are really happy to be here today, and we appreciate the Women's Advisory Fund and Community Foundation of Tompkins County for inviting us to speak. This is our slide one. We're going to cover a lot of topics today, and we're going to move quickly so that we have time at the end of the presentation for a conversation. So if we advance, today we're going to cover these topics. We do hope to do so efficiently, as I said. The topics that we've chosen to share today will give you a strong understanding of our work in the community, and it will inform our conversation at the end of the presentation in regards to abortion rights and access and how we locally fit into that conversation. Next slide, please. Our mission, so PPGNY is a leader of provider. If you don't know, Planned Parenthood provides sexual and reproductive health care services and information. We're a fierce advocate and committed partner to advancing equity and improved health outcomes for all. Formerly, we were known as Planned Parenthood of Southern Finger Lakes, and in 2020, we merged with 4 other affiliates across New York State to become Planned Parenthood of Greater New York, now serving 65% of the population in New York State, becoming the largest Planned Parenthood affiliate in the country. Our current CEO is interim CEO. Her name is Joy DeCalloway. She's been with us for 2 years. And we have a map here that kind of shows you our representation area. A great part of New York State. So we're going to go to the next slide. This is Reviving Radical is a way in which we approach our work in everything that we do. Much of our resolve and strength as an organization comes from our commitment to evolving, innovating, and leading in an equitable way. Reviving Radical provides an organizational approach to listening, learning, and transforming our relationships with communities of color. We do so influences all of our work that we do in education, training, and community engagement. And these are the core goals of Reviving Radical. This was born out of our history of not always representing and presenting in communities the best that we could. And we've acknowledged and we're reckoning with that. And this is something that is in part of everything that we do and informs all of our work. I would like to go on about it, but we're going to go to the next slide and we can talk more about it at the end if you have questions. And now Caroline's going to talk a bit about the clinical services that we do and how we serve our communities.
Hi, everybody. I'm so glad to be here and thanks for joining us. So I'm going to talk quickly about how we fund our work, and then, as John said, we'll launch into an overview of the services and programs that we provide. So this is for our fiscal year 2021. We just last week ended fiscal year 2022, so we don't have finalized figures just yet. But you can see here that the largest share of our funding comes from patient revenue, insurance reimbursements. That's followed by government grants, which account for 30% of our revenues, then individual contributions from our donors for 23%. And then the smallest categories there are investment income and then grants from foundations. So this is a brief overview of our services and programs. We're going to go into each of these categories in a little bit more depth as we go through the presentation. But the work that we do falls into these 4 broad categories. Of course, there's clinical services at the Ithaca Health Center, which is our health center in Tompkins County. We provide education and training, so sex ed for youth, as well as training for professionals. We have community engagement programs that help us build strong relationships with the local community and link people to our services. And then we have external affairs, which includes community organizing and policy advocacy to help promote reproductive rights and justice. And this is a strong focus here in Tompkins County. So like I said, we're going to go into each of these in a bit more depth. Starting with clinical services, what you'll see here is a list of clinical services that are available at the Ithaca Health Center. I won't read through the whole list, but it is a comprehensive range of sexual and reproductive health care. And one important thing to note is that we have a commitment to not turning anyone away. We serve all patients who turn to us, regardless of their age, identity, their immigration status, their insurance status, or their ability to pay. We help eligible individuals sign up for insurance plans at our health centers, or for those who are not eligible for insurance or cannot use it, which is often for safety or confidentiality concerns. We have a sliding fee scale, which makes our services more accessible to those who do not have the ability to pay. Moving on with clinical services, we do offer some telehealth services. We have 2 main channels for telehealth right now. The first is PP Direct. This is a mobile app. Anyone can download it on their phone. It enables access to 3 types of birth control: the pill, the patch, and the ring, as well as treatment for urinary tract infections. And that's all done using a smartphone. And prescriptions are either delivered to someone at their home or delivered to a local pharmacy for pickup. We also have PP Connect. This is our telehealth platform that we launched in April 2020 in response to COVID-19. So this is more of what you think of a traditional telehealth visit, a video or a telephonic visit with one of our providers. And that's for a range of different services, including birth control, emergency contraception, and transgender hormone therapy. This is just a quick breakdown of visits at the Ithaca Health Center during our, actually this is during the most recent 12-month period, July 2021 to June 2022. You can see that we provided over 7,000 visits at the Ithaca Health Center. The vast majority of them fall into a category that we call sexual and reproductive health / family planning. That includes a wide range of services: birth control, gynecological care, STI testing and treatment, HIV testing, cervical cancer screening. That makes up the bulk of the visits that we provide. You'll see that gender affirming care makes up 8%. That's a transgender hormone therapy that we provide. And then abortion-related visits down at the bottom, you'll see that medication abortion visits and follow-up visits together account for 6%. In-clinic abortion procedures account for 4%, and then telehealth, a smaller share at 3%. And then I will turn it over to Dawn for less of a data-driven look at the impact of our healthcare services.
So this is a quote that we pulled from one of our patients recently, just talking about their gratitude to our facility for them and their families. They said the employees at Ithaca Planned Parenthood are truly amazing, and they don't feel comfortable with any other facilities when it comes to personal stuff. Sometimes I'm embarrassed when I go to other doctors, but at Planned Parenthood, that doesn't happen. Without them, my life would be completely different and not in a good way. Thank you so much for making me not making me feel bad about myself, and for never making me feel uncomfortable. We really pride ourselves in exceptional service. This past year, we won the Guardian Award of Southern Finger Lakes. Southern Finger Lakes won an award for patient ratings. We from Press-Ganey, and we're very proud of this. So if we go on to the next slide, the clinical services. Caroline, are you doing the slide? This is, yeah.
Yeah, I'll jump back in. This is just a closer look at who we're serving at the Ithaca Health Center. You'll see that in the patient age category, young people make up, ages 20 to 29, make up 50% of the patient population, which is no surprise given the large student population of the area. The next largest share is those 30 to 39. And then a smaller portion of our patients come from the younger age groups, 19 and under, as well as 40 and older. And then here we also have a breakdown of patients by race, the majority being white, but we are serving people of all identities. And you'll see a note down there at the bottom that of all of the patients that were at the Ithaca Health Center during this 12-month period, 3% identify their ethnicity as Hispanic or Latino. Okay, I'm going to move along, and now that we're out of clinical services, we'll move to the next bucket of programming, education and training. So in the Southern Finger Lakes region and across the state, we provide evidence-based sex education for young people. What evidence-based means is that these are curricula that have been rigorously evaluated and shown to reduce the risk of STIs, HIV, and or unintended pregnancy. So these are tried and proven curricula. We also offer statewide virtual workshops through the Training Institute, which is training for professionals, and that can include educators at public schools or private schools, healthcare providers, social workers, youth workers, and these training sessions help these professionals to be prepared to answer questions about sexual and reproductive health with their clients and to have more confidence in addressing these topics with their clients. And those are available virtually statewide. Dawn's going to speak a little bit about our youth peer education program.
So across the affiliate, we do education in different ways. In Ithaca, we do teen council. It's peer-led education, as we said. We identify students in high school that have an interest. We work with them to become co-facilitators. Last year, the teen council members co-facilitated 73 classroom lessons. So they're going into classrooms in Tompkins County, and they are teaching sexual and reproductive health care to their peers. They did 30 weekly meetings, attended full-day Saturday sessions, and helped recruit 9 new applicants. This has been a tremendous program, and we're very proud of the work that we do in this area. Moving on to community engagement, we can talk a little bit about Out for Health.
Mm-hmm. Out for Health. So moving from education and training to our next category of programming, community engagement. Out for Health is our LGBTQ+ program. It includes outreach in the community, education, support and connection to services, and advocacy locally about how it's important to have LGBTQ+ inclusivity in both care and education. This program was developed in Ithaca and has now been shared across PPGNY, so it was pioneered here. And basically the overarching theme of this programming is making sure that we are helping connect folks to support either at our health centers or other community resources. So we assist patients with making appointments, signing up for insurance, accessing gender affirming care and other services that they might need. And there's also an LGBTQ+ youth group under the umbrella of this program as well. Lots to say, but we're going to keep moving on to external affairs. I will move it back to Dawn.
So external affairs is the way in which we are connecting with our communities and organizing them to work on advocacy and to support our work. We've had 4 rallies this past year and walked in the Ithaca Parade. One of those rallies was planned by our Planned Parenthood Generation Action, which is our network of young activists, and we have 2 chapters. We have 1 chapter between the 2 colleges here, and we also have one in Binghamton University. I'm not going to read that. We're going to. So you see, yes, we'll just move on. Yeah,
I can go. Okay. But yes, the local Advocacy is very strong in Tompkins County for sure.
Yeah.
I'm going to take a moment to talk about external affairs from a statewide perspective. So we partner with elected officials and with Planned Parenthood Empire State Acts, which is a separate statewide Planned Parenthood advocacy organization. And together we all work to advance state level policies that will help promote and advance the reproductive rights of everybody in New York State. So every year we have a policy agenda. I just highlighted two things that are part of our policy agenda. Currently, one is a state bill that would mandate comprehensive sex education at all K through 12 public and charter schools statewide. This has been a priority for several years and will continue to be a priority going forward. Another exciting one is the Equality Amendment. This is a proposed amendment to the New York State Constitution, and that it would ban discrimination based on sex, gender, gender expression, pregnancy, and pregnancy outcomes, including abortion. For an amendment to the state constitution, there's a specific process in place. A law has to be passed by two separately elected state legislatures before it appears as a ballot question to voters. So we just recently had a victory that we had the state legislature pass the Equality Amendment. So that's the first hurdle cleared. It will have to be passed again next year by the legislature, and then it would become a ballot question in 2024. But we're very excited about this victory and moving towards having this amendment made to the New York State Constitution, which would provide very strong protection for reproductive rights above and beyond any legislation, as it would be baked into the state constitution. That's it for services and programming.
Great. We're at 12:17. So as I think probably most of us know, we're looking forward and trying to figure out and plan for what our services will look like in a post-Roe abortion reality. On June 24th, the SCOTUS overturned Roe v. Wade, and as of yesterday, 10 states have partial or full bans on abortion. And then other states are preemptively closing their doors out of fears or inability to meet need. There are 26 states that are at risk of overturning abortion, and that would mean 36 million people of reproductive age who would be at risk of having limited access or no access to abortion. We are lucky in New York State. We have passed in 2019 the Reproductive Health Care Act. It remains safe, legal, and accessible in New York State. Some of you may have seen the executive order President Biden released last week, and it attempts to safeguard medication abortion, emergency contraception, protect patient privacy, launch public education efforts, as well as bolstering security and the legal options available to those. We think this is a great start. Much more needs to be done, and this is just the beginning. Also, proudly to say, Ithaca proclaimed itself an abortion sanctuary city. Our government relations teams has been in communication with local legislators, and we're using that as a roadmap and talking to other cities across New York about how they could do similar legislation to help ensure the privacy and the rights of individuals traveling from out of state into New York State seeking abortion care. Next slide, please, Karen. Thank you. So what does that mean for us here locally and across 65% of New York State, which we serve? We do anticipate a rise in out-of-state patients. We have already seen, since the SCOTUS decision turned, patients from out of state. We don't know why they came to us, right? But we have seen that uptick already. We have known that this is coming for a long time, and we've been preparing for it. The writing was on the wall, no secret. We've been building out our referral networks in states, those 26 states and beyond that are at risk. We've been expanding care at our healthcare centers. That includes here in the Southern Finger Lakes, and expanding our telehealth options. This is our multi-pronged approach. Some of the work that we highlighted that we're doing in policy and legislation and clinical services, this is all tying in to this bigger plan and strategy going forward. Our Cornell Health Center, which is part of historical Planned Parenthood Southern Finger Lakes, started providing abortion services last year. They're close to Pennsylvania. They do see patients from Pennsylvania. Pennsylvania does have some restrictions. They have a 24-hour waiting. It is still legal there. Ohio has instituted a 6-week ban on abortion, and we are just a few hours from the Ohio border there. So how are we responding? What is our plan? we would like to expand options and make it easier for people to come to us to seek care. We have designated abortion patient navigators. These are people that we've hired or hiring to assist people that need to travel to New York. That navigator will help facilitate travel, lodging, and secure funding by working with partner organizations that we've been building out referrals with. We're increasing telehealth medication abortion so that people who are in early stage, I believe it's up to 11 weeks, can access and safely manage their abortions and at home under care of our expert clinicians. So the way that telehealth works, you would receive a virtual evaluation and then you would come and pick up your pills from your nearest Planned Parenthood of Greater New York. So if you're traveling from out of state, that would be one of our facilities in Corning or New York City, but really any of our health centers. And that is something that we'll be doing this summer. We're starting it now, and it will be available for follow-up appointments. What else are we doing? We are expanding our abortion services, as we said, at our health centers in Ithaca and Corning, increasing who we can see and helping to mitigate unnecessary delays. So this means we're hiring and training advanced practice clinicians, thank you, to provide abortion care, and we're seeking to increase the gestational age. That's how far along into a pregnancy that you can have an abortion in one of our healthcare centers. There's additional training that is needed, and that's something that we are doing now. We are also doing a patient escort program locally. We've had a lot of volunteers reach out to us, and in response to clinic staff who have seen an increase in anti-abortion demonstrations outside of our health centers, we're training local volunteers to accompany patients to their appointments and health centers and to provide support. And we've already increased appointment availability at all of our health centers, all 23 of them across the affiliate, by 20%.
One thing I'll just jump in to say, Dawn, is we used our APC acronym internally a lot. Oh, sorry, I advanced the slide. I didn't mean to. Advanced practice clinicians is a category that includes nurse practitioners, physician's assistants, certified nurse midwives, and it accounts for a large portion of our providers at PPGNY.
We have a lot of jargon in the industry, so I do apologize for that. So, a lot of people have been reaching out and asking, what can we do? How can we support? How can we be useful in this terrible, horrible moment for abortion access in the country? And there are three things. There are three things that need to happen now and need to happen quickly, and that is to support. The first one is to support abortion providers. This is Planned Parenthood and other abortion providers in states still providing abortion. We are going to need to absorb patients from out of state and need to be able to do so. We also are asking that people donate to abortion funds. Funds have been around for a very long time. You can access NIAF, that's the New York Abortion Access Fund. There are others, and there's resources we'll share at the end, so you can do that. These are direct funds that people traveling from out of state, any state, into New York to help offset the cost of those abortions. And you need to support travel. We work with Bridget Alliance. It is one of the few, if only, I'm not sure if it's only, referral-based services that provide people seeking abortions with travel, food, lodging, childcare, and logistical support. They're one of our partners. So if someone calls us, they talk to our patient navigator, they say, I'm coming from this place, I need to come here. That patient navigator will help them find an appointment with us or one of our health centers. And then we'll connect with Bridget Alliance, we'll connect with the abortion funds, we'll do those referrals and help them to navigate this network of care. So these are the additional resources. I urge you to go to Guttmacher. They do excellent research. They have interactive maps and up-to-the-minute data about where abortion is legal, where it's not, what the restrictions are, what the protections are. Abortionfunds.org. A link to our annual report, which will dig in much more than Carol and I were able to do today. And then abortionfinder.org helps you or someone you know seeking to find an abortion. And that is the end of our presentation with 4 minutes.
We might slip a little bit over some of our time here. This is very important information, very important services and strategy and advocacy that you historically have been providing over many, many years. And we have a number of folks at the Community Foundation who are very supportive of Planned Parenthood of Greater New York and the Federation as well. Over the past couple of years, like in 2022 year to date, we've had $40,000 of grants coming to Planned Parenthood of Greater New York. Previous years, 36, 34,000. So our donors are very interested in this topic. In the time we have available, I will turn it back over to Susie, the chair of our Women's Fund, who has some questions that you've all provided earlier, and also have questions in the chat. You can do that as well. So Susie, can you provide some questions to Caroline and Dawn? Caroline, excuse me, and Dawn.
Yes, we have a few minutes left, so I'm going to try to do my best here with a few that have come in and a few in the chat. A lot of the questions you covered already in your presentation, so I'm going to skip over those. I think one of the questions, are there plans or research to improve birth control options that would hopefully help reduce abortions needed?
I can jump in on this, Dawn. You just spoke for a long time. So together with PPFA, Planned Parenthood Federation of America, which is our national umbrella organization, we're constantly monitoring developments in this field, including potential new birth control options. And there's been a lot more attention to how we can make birth control more effective and more accessible in this post-Roe era. There's some things that have been discussed are, mailing options or making birth control available over the counter. In the past, PPGNY has conducted clinical research on birth control in New York City, including a recently concluded trial that tested a new copper IUD. At the moment, we're not conducting any research studies, but it's something we've done in the past. And as I said, we're constantly monitoring to make sure that we're up to date on the developments, keeping abreast of what's available and what we can offer to our patients.
Great, thank you. Stacy wrote in the chat, how does one find out how to be an escort? Is that a volunteer opportunity open to everyone, or are there requirements?
Both of those things are true. It is an opportunity that is open to everyone. We do have training requirements, and our training that we're doing in the next couple of weeks is full, but if she is interested in doing our next round of training, she could reach out to me directly. I'll put my email in the chat and I can connect her to do that. We are looking for escorts in the Corning area. So if you are in the Corning area, we have a high need there.
And thank you. Jordan says, or rather asks, besides volunteers, is there any security outside the clinic? Do local police come for security, especially for people who are walking there and may be followed when they leave?
We have a strong relationship with the local police department. We don't really discuss our security publicly, but we do have secure facilities.
Great. Let's see, I don't know. Do we have time for one more, George?
Sure, if you want to do one more, that'd be great.
Okay. Let's see, how about, here's a question. What happens next? Will unwanted pregnancies become a giant problem?
It's hard to tell. It's still so, the landscape is shifting rapidly. The policies state by state are changing, day to day. What we know for sure is that 26 states are expected or certain to ban abortion or severely restrict it. And as Dawn said, that impacts about 36 million people of reproductive age. And the other thing we know is that the populations that already face really formidable barriers to accessing healthcare are going to be the ones who are most impacted. People of color, low-income people, people who live in rural areas who are already less able or unable to travel to other states. So, I mean, when we look at that landscape, when we look at what we know, I think it's clear that the situation is not good, but it's hard to tell exactly what will happen. The one thing that we can say is that the landscape today is different than it was before Roe v. Wade. We talked about how there's a national network of abortion funds now that do help people access care. And medication abortion is an option now, which didn't exist pre-Roe. But yeah, it's definitely, it's a grim situation to be sure, very disheartening.
Yeah, I mean, ultimately we're 3 weeks in, almost 3 weeks into this, and each day it changes state by state. We are anticipating, we project a, was it 10 to 12% increase in our local health centers from patients seeking care from out of state. But we're preparing, right? We must just be prepared for worst case scenario, because we do see that it, for people that this is affecting, it is deeply affecting them. And there are no words. So
I want to thank you for the work that you've done always, the work you're doing now, the work you will continue to do, the support of that work by many people on this Zoom. Philanthropy at its core, especially community foundation and community-based philanthropy, is about addressing needs as they change and conditions in our community, and using all of our resources, time, talent, treasure, testimony, which you provided today, and ties, our relationship to each other, to improve the quality of life for everyone. And we are embedded in the mission of the Community Foundation to advance justice. And I think a lot of what we're talking about today are social justice issues and concerns. And that's why this is an important topic for us. We need to continue to revisit it. And this is just a bit of a quick taste of this. This video and your PowerPoint will be on our website later today, along with links. Encourage people to make contacts directly with the Ithaca office for additional questions. We'll continue to follow up on this. And I want to thank the Women's Fund of the Community Foundation for co-hosting this with us. Our next Let's Talk will be August 9th with Jordan Clemens from Unbroken Promise Initiative about community organizing. There's considerable overlap with this topic of sexual and reproductive rights and healthcare and community organizing, as you've clearly demonstrated today. As you have additional ideas for speakers and topics for future Let's Talks, Gloria is now our lead person here at our office. And I want to thank all the great work that Amy and the entire staff of the Community Foundation have done in continuing to do this. These are somewhat challenging and frustrating, and so you get just a little bit of a taste of this in 30 minutes, but not everything that you need. So this is not meant to cover everything comprehensively. It's meant to make connections and relationships and identify resources for you all to decide how to take your next action in this important work of creating our beloved communities. So I want to thank both Carolyn and Dawn and the folks from Planned Parenthood of Greater New York, Susie, and the other folks on our Zoom today from our Women's Fund and our staff. And we'll end the recording now. I will ask that if the presenters and Community Foundation staff